96.7 FM Pasco, 102.9 FM South Tampa, 970 WFLA, all over Tampa Bay.
Thank you so much for continuing to watch and listen to American Medicine Today. I'm alongside my friends Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonatti. Now, emerging evidence suggests that COVID-19 patients are especially vulnerable to a common fungus that has been found to be the direct cause of death, and physicians around the country are raising the alarm. Joining us to discuss is Dr. Farah, cardiologist at Baylor Scott White All Saints Medical Center and Texas Health Hospitals. Thank you for joining us, Doctor.
Thank you for having me. How are you doing?
Very good. And why don't you start off by telling us, what this common fungus, is it Aspergillus? What that is?
Sure. It's Aspergillus, the name of the fungus. And so it's actually a well-known fungus. We see it quite often in the hospital setting, and it's usually seen in patients who are immunocompromised. Okay. So over the course of the years, people who have been infected with the flu virus, the common flu virus that we see every year in severe flu infection patients who are typically in the ICU and immunocompromised state, they typically get a secondary infection with, they can get that infection with this virus.
And so this fungus, it's apparently found everywhere from what I understand. What is the direct link to the cause of mortality with COVID patients?
You're correct. This is a very common fungus. We see it in the air. The spores are a lot of times in the air. It resides in the soil, in plant matter. So what's causing the mortality? Well, it's because in a similar fashion to what we saw in flu patients, COVID patients who are very sick, they are immunocompromised. And so they are susceptible to catching this fungus and actually getting infected with it. So the mortality rises because they're already very sick. And this fungus actually can cause infection in the lung by causing pneumonia. It can actually cause like a ball of infection within the lung. It's abscess, basically lung abscess. And in a patient who is already battling with so much going on with COVID, COVID can cause multi-system disease. It can affect the heart, the lungs, and then you add something like this, a superimposed infection, it really can increase their mortality rate because now they're battling with so many things.
Mm-hmm. And why is it so difficult for doctors to really diagnose this fungus?
It's a number of things. Like I said, usually the patients who catch this, they have a number of other very serious conditions going on at the same time. And so, fungus in general, it doesn't usually show up in the lab. You have to do specific tests for this particular type of fungus. There are good diagnostic tests, like lab tests. You can culture them. There's something called PCR, which is polymerase chain reaction, which is probably the best way of diagnosing it. So there are good diagnostic modalities, but your suspicion has to be pretty high up there because you have to be able to order the correct lab work to be able to diagnose it.
I know when you have COVID that they try to put you on steroids to help, but don't those steroids actually make this fungus take hold more?
That is a very good question, and you're right. So when somebody is sick with something like COVID-19, for instance, their body's focus and all the concentration goes into fighting the infection alone. So already they're to some degree immunocompromised just from fighting the virus itself. And as you know, COVID-19 is causing a lot of inflammatory reaction within the body. And to suppress that inflammatory reaction, we are giving steroids, as you mentioned, to help the patient not get too sick. And yes, steroids are immunosuppressant medications. And so it suppresses the immune system even more, and that makes them more susceptible to catching this fungus. So it's kind of a catch-22 situation. It truly is a vicious cycle.
And so what can patients do to, limit exposure to this fungus if they do get the disease, or even any of us, preemptively to try to keep this fungus from getting in our lungs?
Yeah. So in a normal, healthy, immunocompetent person like you and I, we are actually exposed to this fungus every day. We inhale it to some degree, but we typically don't get infected with it because we have a competent immune system. But for those who are sick or are immunocompromised or are on medications that exposes them to, be more vulnerable to this fungus, the way to prevent would be, prevention of like getting exposure to soil, plant material, and keeping clean in your household, like dust. A lot of this lives in the dust, and mold. We need to avoid mold. Mold is a major source of getting this fungus. So those would be the things to watch out for.
And so we're basically out of time, doctor, but I like to ask this of every expert in the field of medicine. What are your thoughts on actually finally getting back to normal, getting this virus tampered down? The vaccine obviously rollout is supposed to help and is helping. When do you see society returning to normal?
I think we still have quite a long way to go, unfortunately, before we can completely get back to normal. But, the important thing is that the vaccine is out, and now it's up to us, the population. We've got to take the vaccine. The vaccine is very good. It is working from the data we have so far. So we've got to do a better job of vaccinating our, majority of our population. And then the simple things that the CDC has been warning about, like, wearing your mask in public area, washing hands, avoiding crowd, avoiding traveling if you can't avoid it. So these things we must continue to follow until we can get back to normal again.
I just want to jump in, and I know it goes kind of against the status quo, but don't they typically say too much antibacterial soap, too much sanitizer kind of kills your own immune system from working properly?
We have talked about this in the past. Yes, that has been one of the concerns from the infectious disease community within medicine. But right now, in the midst of a pandemic with a very contagious virus, we really do have to wash our hands. In a long-term setting, yes, that is, you're correct. It does. But at this time, the best thing to do would be to actually use those antibacterial soaps and antiviral soaps and stay clean.
All right. Well, great words of advice. Thank you so much for being on the program, Dr. Farah, for joining us on the show.
Thank you for having me. It was a pleasure.